Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Mr. Evans. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Evans. How are you feeling today?
I'm doing all right, thank you. I've been a bit worried though. I've been experiencing some strange abdominal pains for a while now.
I see. Well, we're here to figure that out together. Can you describe the pain a bit more? Where exactly is it located and how long have you been noticing it?
It's kind of a deep, gnawing pain in my lower abdomen, slightly to the left. I've had it on and off for a few months now, but it's gotten worse in the last couple of weeks.
Thank you for that description, Mr. Evans. Has the pain been constant or does it come and go?
It's not constant. It comes and goes, but when it's there, it feels quite uncomfortable, almost like a dull ache.
Any other symptoms you've noticed? For instance, any back pain, nausea, or changes in how you feel generally?
Actually, yes. I've had some lower back pain recently. It's not intense, but it's there. I don't feel sick or anything, but I do feel more tired than usual.
I'd like to ask if you've noticed any pulsing sensation in your abdomen, especially when you lie down?
Yes, now that you mention it. It's like a throbbing feeling, which I thought was just my pulse, but it does feel odd.
Thank you for sharing that. Based on what you've told me, I'm concerned that you might have something called an abdominal aortic aneurysm. It's a condition where the large blood vessel that runs through your abdomen, the aorta, becomes enlarged or weakened, and that pulsing sensation could be related to that.
An aneurysm? That sounds serious. How did this happen? I mean, I've always thought I was healthy.
It can be serious, yes, but the fact that we've caught it early means we can explore the right steps moving forward. There are several factors that contribute to the development of an abdominal aortic aneurysm, or AAA. Age, high blood pressure, and smoking are some of the most common risk factors. It's also more common in men and can sometimes run in families. Have you ever been diagnosed with high blood pressure?
Yes, I've been on medication for it for the past 5 years. But I quit smoking a long time ago. Does that help?
It definitely helps that you quit smoking, one of the best decisions for your overall health. However, high blood pressure can put extra strain on your arteries, contributing to this kind of issue over time.
So what exactly happens with an aneurysm? Should I be worried?
An aneurysm occurs when part of the artery wall weakens, causing it to bulge or expand like a balloon. The danger arises when the aneurysm grows too large, as it can rupture, leading to life-threatening internal bleeding. However, the key is to monitor the size and rate of growth of the aneurysm. If it's small, we can manage it with lifestyle changes and regular monitoring. If it's larger, we may need to consider surgery to prevent it from rupturing.
Surgery? What kind of surgery are we talking about here?
There are a couple of options depending on the size and location of the aneurysm. One is an open surgical repair, where we remove the damaged part of the artery and replace it with a synthetic graft. The other, less invasive option is endovascular repair, where we insert a graft through the blood vessels using catheters. Both have high success rates, and the choice depends on the specifics of your case.
I see. How would you know if it's big enough to need surgery?
The next step would be to confirm the diagnosis through imaging, most likely an ultrasound or CT scan. These tests will show us the exact size of the aneurysm and its location. Generally, if an aneurysm is smaller than 5.5 centimeters, we monitor it closely with regular scans. If it's larger or growing rapidly, then surgery might be recommended. We will also discuss how you're feeling, since symptoms like pain or discomfort can influence the decision to act sooner.
That makes sense. I guess I'm still trying to wrap my head around all of this. Is there anything I can do in the meantime to help?
Absolutely. The key to managing an aneurysm is controlling any risk factors that can cause it to worsen. That means keeping your blood pressure under control, which you're already doing with medication. I'd also advise avoiding heavy lifting or strenuous activity that might put extra pressure on your abdomen. Staying active with moderate exercise, eating a healthy diet, and avoiding tobacco are essential. We'll also need to keep a close eye on your cholesterol levels.
All right. I've been trying to take better care of myself, but
Extract 2. Questions 13 to 24. You hear a specialist talking to a patient called Mr. Glenn. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello. Come in, Mr. Glenn. I've received your file from your GP regarding your ongoing symptoms. I understand you've been experiencing a persistent cough and fatigue for some time now.
yes, that's right. It's been about 6 weeks. My GP thought it was a chest infection at first, but the antibiotics didn't help. The cough is still there, and now I'm feeling more tired than ever.
I see. Your GP mentioned that you've also experienced some weight loss. Is that correct?
Yes. I've lost about 10 pounds in the last 2 months, but I haven't changed my diet or anything like that.
That's concerning. Weight loss without an obvious cause, combined with a persistent cough and fatigue, suggests we need to explore other possibilities. Have you had any night sweats or fevers recently?
Yes, actually, I've been sweating a lot at night, and sometimes I wake up soaked. I didn't think much of it at first, but it's been happening more often.
That's an important detail. Along with your symptoms of cough, fatigue, and weight loss, night sweats and fever can be signs of a condition like tuberculosis TB.
Tuberculosis? I thought that was something from the past or something people get in other countries.
While TB is less common in places like ours than it used to be, it still occurs, particularly in individuals who may have been exposed to it. It's important to rule it out because TB can sometimes take months to show symptoms, and it requires specific treatment. Have you traveled abroad recently or been in close contact with anyone who has TB?
I haven't traveled, but I work at a community shelter. We've had some people coming in from different parts of the world. I didn't think much of it, but now I wonder.
That could be a potential source of exposure. TB is transmitted through the air when an infected person coughs, sneezes, or even talks. It doesn't mean you'll definitely have it, but we should definitely run some tests to check.
What kind of tests will I need?
The first step is a chest X-ray to see if there are any signs of infection in your lungs. We'll also perform a sputum test, which involves taking a sample of the mucus from your lungs to check for the TB bacteria. Additionally, we may run a tuberculin skin test or a blood test to determine if you've been exposed to the bacteria.
Will the tests show if I have TB right away?
The sputum test will give us the most definitive results, but it can take a few days. The chest X-ray will give us an indication if your lungs are affected. And the skin or blood test can tell us whether you've been exposed to TB bacteria. Based on the results, we'll know what steps to take next.
I've heard TB can be serious. What happens if I do have it?
TB can be serious, but the good news is that it's treatable with a course of antibiotics. The treatment typically lasts about 6 to 9 months, depending on the severity of the infection. It's important to follow the entire treatment plan because TB bacteria can be resistant if the medication is not taken properly.
6 to 9 months seems like a long time. What happens if I don't take the medicine the right way?
That's a great question. If you don't complete the treatment, the TB bacteria may not be completely eliminated, and they can develop resistance to the antibiotics, making it much harder to treat. This is called multi-drug resistant TB, which is much more complicated and requires stronger medications over a longer period.
So it's really important to take the medicine correctly.
Exactly. The treatment involves taking multiple antibiotics, and in some cases people may feel better after a few weeks and think they can stop. But stopping too early can be dangerous. We'll monitor your progress throughout the treatment to make sure everything is going as planned.
What about spreading it to others? Am I contagious now?
TB can be contagious, but typically only if it's in its active form. Based on your symptoms, if you do have TB, there's a possibility it could be active, meaning you could spread it to others. That's why it's important to start treatment as soon as possible. Usually, after a few weeks of taking antibiotics, you would no longer be contagious. But we'll guide you through that process to make sure it's safe for you and others.
That's a bit worrying. Should I avoid work in the meantime?
It's probably best to avoid work, particularly if you're working in close quarters with others. Once we get the test results and confirm whether or not you have TB, we can give you more specific advice on how to protect yourself and others.
What about side effects from the treatment?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional talking to a patient. Now read the question.
So, Mr. Thompson, I'm going to talk you through your hormone replacement therapy, HRT, treatment for menopause. HRT can be very effective in relieving symptoms such as hot flashes and night sweats. Your treatment will begin next week, and we will monitor your progress closely over the coming months. However, there are some side effects I need to make you aware of. Most importantly, HRT can increase your risk of developing blood clots, which could become serious if not addressed early. We will ask you to be mindful of any signs of swelling or pain in your legs and contact us immediately if you notice anything unusual. You may also experience bloating and breast tenderness as part of the treatment. And next.
Now, look at question 26. You hear a medical professional explaining a diagnostic procedure to a colleague. Now, read the question.
Stories she heard from a friend. I've tried to reassure her that we'll manage the symptoms, but she still seems hesitant. I explained to her that the treatment is important, but
who knows if she actually took in what you said or if she'll even consider moving forward with it. Do you think the family member that came with her today will help convince her?
I'm not sure. Her daughter seems really concerned about her mom, but I don't think she knows enough about the treatment process either. I think we should keep trying to address Mrs. Carter's concerns directly and explain things again, maybe in simpler terms.
Now look at question 27. You hear a nurse trainee talking to a mentor. Now read the question.
Hello, Dr. Smith. I have a situation I would like to discuss with you.
Sure, go ahead. What's the case?
I have a mother who brought her 18-month-old daughter to the clinic for a checkup, but she's hesitant to continue with the scheduled vaccinations. She believes the child is too young for so many vaccines and worries about side effects. She's otherwise cooperative but clearly anxious. I know what the recommended guidelines say, but
What concerns or objections has she specifically mentioned about the vaccines?
she's concerned about the long-term effects of multiple vaccines given at such a young age. She has read a few things online that make her believe the vaccines could weaken her daughter's immune system.
It sounds like you've identified the key issues here. So, what are you thinking might be the best way to proceed in this case?
I believe I should provide her with factual information about the safety and benefits of vaccines, while also addressing her specific concerns about side effects. But I want to make sure I'm taking the right approach, given her anxieties.
Now look at question 28. You hear a nurse talking to another nurse about a patient's hydration and nutritional monitoring. Now, read the question. Hi, Sarah. I wanted to ask you something about Mr. Edwards' chart. You know, the elderly patient who was admitted with dehydration and is on a strict fluid balance chart.
Yes, I know who you're talking about.
I noticed that you didn't record his fluid intake after lunch yesterday. His intake needs to be tracked carefully, especially with his dehydration concerns.
Yes, I know, but he seemed to be drinking steadily throughout the day, and I didn't think it was necessary to write down every little bit.
Well, it's important to stick to the physician's order and record everything. Missing any details could lead to an inaccurate assessment of his hydration status. I'm worried that this might affect the monitoring on future shifts. Now look at question 29. You hear a dermatologist discussing with a patient. Now read the question.
You've done a great job using the topical treatments I recommended. However, it seems like the patches of melasma on your face have darkened. While topical treatments can help manage melasma, sun exposure remains a major trigger for its recurrence. Even brief exposure can make it worse, especially without proper sun protection. I noticed you've been spending more time outdoors recently, which could explain the worsening of the condition. The sunscreen you're using is good, but it may not offer enough protection. It's important to use broad-spectrum sunblock with a high SPF and reapply it regularly, especially if you're outside for long periods.
I see. I didn't realize being in the sun could have such a strong effect, even though I use sunscreen.
Yes, exactly. For melasma, it's not just about wearing sunscreen, but also about avoiding direct sun exposure whenever possible. Hats, sunglasses, and seeking shade are just as important. While your topical treatments are doing their job, limiting sun exposure is critical in preventing flare-ups. It's likely that your recent sun exposure has caused the melasma to darken again.
Now look at question 30. You hear a nurse talking to a doctor about a patient. Now read the question.
Do you have a moment? I'd like to discuss a case with you.
Of course. What seems to be the issue?
We have a patient, Mr. Tom, a 52-year-old male, who came in with a rather peculiar complaint. He says his tongue looks green and furry. He describes a strange texture, and upon examination, I noticed that the papillae on his tongue are overgrown and have a greenish tint. He doesn't have any significant pain,
and there are no signs of infection. However, he is understandably concerned about the appearance.
That sounds like a case of hairy tongue or lingua villosa. It's a benign condition, but it's important to address the cause. Usually, it results from poor oral hygiene, smoking, or certain medications. The discoloration likely comes from the buildup of debris and bacteria. We'll recommend proper tongue hygiene as the first step.
How should we proceed?
The best course of action is for Mr. Tom to brush his tongue daily with a soft toothbrush and maintain good oral hygiene. He should also reduce any contributing factors, such as smoking or using mouthwashes with peroxide. If he follows these steps, the condition should resolve in a few months. No immediate medical intervention is necessary unless symptoms worsen.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a specialist in bioethics called Dr. Sarah Whitfield giving a presentation on the ethical implications of genetic testing. You now have 90 seconds to read questions.
Hello everyone, I'm Dr. Sarah Whitfield from the Bioethics Department at the University of New Haven. Today, I want to address a critical and emerging topic in the field of healthcare, the ethical implications of genetic testing and personalized medicine. With the increasing availability and sophistication of genetic tests, we now have the ability to predict, diagnose, and even prevent a range of medical conditions before symptoms appear. But this also raises some complex ethical issues that we are still grappling with as a society. I hope that by the end of today's discussion, we'll have a clearer understanding of the potential benefits and challenges involved in these advancements. So, what is genetic testing? It involves analyzing a person's DNA to look for genetic variations that may increase the risk of certain diseases or conditions. This can lead to personalized medicine, where treatments are tailored to an individual's genetic profile, potentially offering more effective and targeted therapies. This technology promises to revolutionize the way we approach healthcare, especially in fields like oncology, cardiology, and rare genetic disorders. However, as with any medical breakthrough, there are ethical concerns that we must address. One of the most significant issues is privacy. When individuals undergo genetic testing, the data collected is incredibly personal and sensitive. Unlike most medical information, genetic data doesn't just reveal information about the individual being tested, but also about their biological relatives. Who should have access to this data? Should employers or insurance companies be able to use it to make decisions about hiring or coverage? We already see some legal frameworks in place, such as the Genetic Information Non-Discrimination Act in the US, which prohibits discrimination based on genetic information in employment and health insurance. But even with such regulations, concerns about privacy remain, particularly in terms of who has the right to access and share this data. Another issue is informed consent. Genetic testing often reveals complex information that can be difficult to understand. How do we ensure that individuals are making fully informed decisions about undergoing testing, especially when the results can have far-reaching consequences for themselves and their families? It's not enough to just provide someone with a document to sign. Healthcare providers need to ensure that patients truly understand what their genetic data might reveal and the potential emotional and social implications. And then there's the question of equity. Genetic testing and personalized medicine tend to be expensive, and not everyone has equal access to these cutting-edge technologies. This raises concerns about fairness in healthcare. Are we creating a system where only the wealthy can afford the best treatments while others are left behind? Personalized medicine has the potential to deepen the divide between different socioeconomic groups, and this is something we must carefully consider. How do we ensure that all patients, regardless of their financial situation, can benefit from these advancements? A recent study highlighted some of these issues. It showed that while genetic testing is becoming more widely available, individuals from lower income backgrounds are significantly less likely to undergo testing, often due to cost or lack of access to specialists who can interpret the results. This not only limits their access to personalized treatments, but can also increase health disparities in the long term. It's clear that access to genetic testing must be addressed if we want to avoid a two-tiered system in healthcare. Moreover, there are concerns about the psychological impact of genetic testing. Finding out you have a predisposition to a serious illness, such as Alzheimer's or cancer, can cause significant anxiety. Even if you never develop the condition, how do we support individuals emotionally as they navigate this new information? Are we prepared to provide adequate mental health support for patients who may struggle with the results of their tests? There are also ethical concerns about the potential for misuse of genetic data. Could we see a future where genetic testing is used to design babies, or where certain traits are selected over others? These concerns, while still largely hypothetical, are already beginning to surface as we look at how genetic information can be applied. In conclusion, while genetic testing and personalized medicine hold enormous promise, we must navigate the ethical challenges they present carefully. Privacy, informed consent, equity, psychological support, and the potential for misuse are all issues that require thoughtful consideration. I believe we can develop policies that promote the responsible use of these technologies, ensuring that everyone can benefit from them without compromising ethical standards. But the conversation must continue, and solutions must be proactive, not reactive.
Extract 2. Questions 37 to 42. You hear Dr. Emily Carter explaining the importance of interprofessional communication workshops. Now, read the questions. You now have 90 seconds to read questions.
Good morning, everyone. I'm Dr. Emily Carter, and today I'll be discussing the importance and effectiveness of interprofessional communication workshops in healthcare. What these workshops do is help healthcare professionals from various disciplines collaborate more effectively, especially when it comes to handling complex and sometimes sensitive discussions about patient care. The reality is that healthcare today is rarely a solo endeavor. More often than not, doctors, nurses, pharmacists, and other allied health professionals need to work together. And effective communication between them can be the difference between a patient thriving or experiencing complications. Despite the critical role of teamwork in healthcare, communication failures between professionals are surprisingly common. These breakdowns can result in treatment delays, medical errors, and even harm to the patient. Yet many clinicians report that they haven't received formal training on how to communicate effectively with other members of the healthcare team. Interprofessional communication workshops are designed to fill this gap. They offer structured learning experiences where healthcare providers can develop and refine their communication skills in a safe and supportive environment. During these workshops, clinicians from different backgrounds come together to practice handling difficult conversations, clarifying roles and responsibilities, and navigating conflicts that can arise when working in high-stakes environments like hospitals. But why do we need these workshops? Well, one reason is that many healthcare providers feel burdened when dealing with complex cases because they're not always sure how to approach delicate conversations. Whether it's explaining treatment plans to colleagues from different disciplines or talking to patients about difficult diagnoses. Another reason is that healthcare delivery is increasingly moving towards a team-based model. This model requires clear and open lines of communication, but achieving that level of collaboration doesn't happen naturally. In fact, studies have shown that poor interprofessional communication is a leading cause of medical errors. So, training that focuses on improving these skills is not only beneficial, but essential. Our team recently conducted a study where we implemented a series of interprofessional communication workshops across several hospital departments. In these workshops, clinicians participated in role-playing exercises where they practiced communicating during various medical scenarios. Some scenarios involved high-pressure situations like critical care, while others focused on everyday interactions that could easily escalate into miscommunication without proper handling. The goal was to give participants a chance to practice speaking clearly, listening attentively, and recognizing when they needed to slow down and ensure their message was fully understood by everyone involved. What were the outcomes of this study? Well, before I get to that, let me give you some context. We surveyed participants before and after the workshops to assess their confidence in handling interprofessional communications. Prior to the training, many of the clinicians reported feeling unprepared for conversations with colleagues from different disciplines, particularly when the discussion involved conflicting viewpoints or complicated medical jargon. However, after the workshops, there was a noticeable improvement. Nearly 80% of participants felt more confident in initiating conversations with their peers, and they reported feeling more equipped to manage disagreements that might arise during patient care. One thing that stood out to us was how the workshops improved not only communication skills, but also self-awareness. When you're in the middle of a busy day, it's easy to forget that communication isn't just about what you say, but how you say it. Many participants commented that the workshops helped them become more mindful of their tone of voice, body language, and even the timing of their messages. For example, some realized they were rushing through explanations because they were worried about time, but that only left their colleagues confused and frustrated. By slowing down and paying attention to their delivery, they were able to create a more collaborative atmosphere. So, how does this impact patient care? The most immediate effect we saw was a reduction in the number of communication-related errors. Departments that implemented the workshop saw fewer instances of miscommunication, leading to treatment delays or confusion over patient care plans. But beyond that, improved communication between healthcare professionals created a more positive work environment. When clinicians feel heard and understood, they're less stressed and more focused, which ultimately benefits the patient. Looking at the broader picture, if we continue to implement these workshops across the healthcare system, we could see significant improvements in both patient outcomes and clinician well-being. Improved communication not only reduces errors, but also fosters a culture of respect and collaboration. So to sum up, interprofessional communication workshops are an invaluable tool in modern healthcare. They help clinicians navigate complex discussions, enhance self-awareness, and ultimately improve the quality of patient care. Thank you for your time, and I hope you'll consider how these workshops can benefit your practice.
That is the end of Part C. You now have 2 minutes to check your answers.